Okay, Ranchella provides support for the foster parents in the treatment foster care program in many different ways. There's the support meetings every month. There's the individual family meetings with the director every month to talk about the month and how it's been. There's weekly meetings with the case manager to talk about the child and their behaviors and any techniques that might help. And then there's phone calls, like we can phone them anytime, day or evening. There's always people on call. And then there's just individual programming, like powwow, swimming, art therapy, occupational therapy, all sorts of different support areas are just covered and provided. The supports have helped us in our role as foster parents because if we're not experts with kids who have high needs, so it's always helpful to be able to call somebody and who's dealt with these sorts of behaviors. And who actually has some history with these girls because they were in the group home first before they came to our place. So it's always helpful in that way. You can just call and say, you know, this is sort of what's going on. This is the situation. What are your best thoughts on how to handle it? And then we just sort of go with what we think and what they say and try and incorporate it into something that works within our home. And it makes it a lot easier because we're using terminology that they're already used to and techniques that they're used to, and so we're not throwing something completely new at these kids. The respite process that's available to us is actually really handy to have. We have utilized it. For just different reasons, like we have 2 adult sons who once a year we try to spend some time with just them because they're usually surrounded by lots of little girls. So it is helpful in giving us that break to be able to spend some time and reconnect with each other, with our own kids, just to make sure that everybody in our family is doing well. Because when we started this, we wanted to make sure that everybody in our family was doing well and would continue to do well. So we ensure that the care remains consistent between the respite family and the foster care home because she's part of the same team and has taken the same training and attends the same workshops. And we provide the respite care family information sheets about the child that talks about their behaviors or likes, dislikes, schedules, habits, and their crisis plan. If they go into crisis or start having some challenging behaviors, it says what techniques work best to de-escalate these kids and bring them back to their baseline. And sort of just to help them out. So she incorporates that into her home and it makes for a smooth transition.